Good morning, everyone. My name is Kath Mardon, and I'm privileged enough to, and blessed enough to work at Mediclinic with Mntambo, who's going to be doing the talk with me. We're going to speak to you on ECMO emergency preparedness. Okay, so ECMO Specialist Training Manual, have you seen it? 4th edition, we call it the Blue Book. In chapter 32, ECMO emergencies, Michael Hurd speaks to the ELSA registry database review and says that mechanical failures happen approximately 40% of the time with the ECMO cases. And he also says the tiniest change can signal impending disaster. We can't be lulled, he says, into false sense of security by periods of relative calm and minimal changes in care patterns. It is imperative that especially trained staff stay at the bedside at all times for prompt recognition, management, and prevention of disastrous scenarios. There is also a description of the provision of and delivery of ECMO being similar to the process of flying a B-52 bomber, where Air Force pilots can go through hours of boredom interspersed with moments of stark terror. Okay. So I don't want the stark terror. I'd rather be prepared. Okay. So we need to prevent. So you've heard prevention is better than cure. How do we prevent? We need to educate, and we need to do our checks, we need to travel, So in terms of education, we need head and hands, not just our hearts, to be passionate about something. So how do we feed our heads? We have programs that include ECMO 101, our ECMO specific courses that we're doing today. And then, of course, on the ground, we need to have advanced CPR courses intermingled with our critical care nursing courses. And if you're on ER 24, if you are in theatre, you need to also be proficient in your field of expertise. And of course, with theoretical proficiency, you also need practical proficiency. And then we talk about wet lab or water drills. Have you heard of water drills? And so their specification is if you're dealing with an emergency in a water drill, you need to restore circulation within 3 minutes. So that's quite intense. And of course, you have practical sessions and practical exposure actually at the patient. Next slide. Okay, along with education, you need to then do checks so that you can just see the smallest change. Remember, the smallest change can signal disaster. So this is quite a busy checklist, but we do this on an hourly basis. You're checking cannula for color change on your different cannula, your venous or your arterial. You're checking for kinks, thrombus, cracks, whether the thing is pulsating or not. You're also checking for perfusion of your actual patient. So you're not just checking monitors and cannula, you're actually seeing how it's affecting your patient. And your pump, to see the slightest change in pressure, whether it's positive or negative, how that's going with your patient. Next slide. And then the 12-hourly check is actually more of the disaster preparedness that we talk into. So if you look at the top section, it talks of alarms. You don't want your intervention alarm to be set on, and then if something happens on your machine, it shuts down, which actually happened with one of our cases. And also emergencies, do you have your hand cranked, do you have your protamine sulfate, and so forth. And your ECMO gases, are you actually linked up? Are you actually delivering what you're thinking you're delivering? And do you have an extra pump, and so forth in theatre? Next slide. Okay, so it's not just in your cubicle that you're going to be nursing your patient. What if you transfer? Do you have everything ready for that? On this checklist, this is a transfer checklist for in your hospital. If you're going through to your X-ray department, for example. And so what does everybody do? What does your perfusionist look after? What does your RN and your EN and your ENA look after, and your care worker? So you are welcome to these slides, by the way. And then do you have an ECMO disaster little kit? So Sue will be showing you that we actually have Tupperwares for IV, airway, and then your accidental decannulation. So not just in the ICU, wherever you are, you need to be prepared. It's also a team approach. So is your theatre ready if there's a disaster that happens? Are they fully stocked with the relevant cannula? Do they have a second machine, extra circuit? Do they have the sterile packs with all the instruments there? And then even backup personnel. So if something disastrous happens, can you just phone this one number? And will just the cascade of events just happen while you're trying to save your patient? You as an ICU nurse can't be phoning every single number of the call-out team. Okay, so cascading on call. So when you said yes to coming to today, you would have been emailed these guidelines, Alfred Health guidelines. And before even the pump failure section and the circuit rupture section, you would have then had prevention. So it speaks into cannula positions, the dressings, when you're moving and turning the patient and so forth. So you would have gone through that already, I hope. And then troubleshooting. So if little niggles happen and if those alarms happen, what will you do about it before you now have a disastrous situation? Okay, so being prepared and educated will help you handle emergencies efficiently. Next slide. You can never be prepared enough for any disaster. Next slide. Okay, so you have to have the right person, the right plan, the right preparation, the right equipment, monitoring, rescue, and attitude. So this was also taken from our blue book, page 263, I think. Next slide. So in your mind, you have to have what if, and then what? What am I going to do about it? So I like ABC, like the rest of us. So airway, what happens if I have accidental extubation? Am I ready for that? I can't just have a tube. I have to have everything right down to like how big my syringe must be as a puffer. And do I have that with me? What about breathing, your ventilator malfunction? Do you have a BVM? Do you have an extra vent? And lack of oxygen, as we know with COVID. Do you have cylinders, enough cylinders? Do you have cylinders that actually can attach your ventilator to it? You know, you're with a Heyer connector. And if you're in X-ray, say, for example, and your cylinder runs dry, where is your point, your oxygen point that you can plug into? And is your cable long enough to get there, or your tubing? What about circulation, your hemodynamic instability? So you've got a monitor. Is it actually accurate? Are you monitoring the correct things? And do you have your curious tone on? And if you do have hemodynamic instability, do you have backup inotropes and your volume expanders, say, for example? And if you have a bleed, do you have blood? Have you sent your cross-match through to blood bank? Check on a daily basis. Do you then have backup blood that's accessible ASAP? Okay? And what if they bleed and it's actually hit and, you know, it's the heparin that you're having a problem with? Do you have protamine sulfate? We had to get that in, so just be careful with that. And accidental decannulation, do you have your emergency kit? Do you have clamps? You need at least 6. And cannula. If they then start waking up and getting restless on transfer, do you have those drugs? Your sedation and your paralytics? And your extras. What if you don't have power, your generator goes? Do you have enough battery backup? Do you know how long that battery on each of these machines lasts for? Okay, and also, say, for example, your battery goes. Do you know where to plug in if you're in X-ray? Is your cord long enough? What if your machine malfunctions? Do you have that hand crank? Do you know how to work it? Do you know how to place it on the console, on the side? Do you know how to unclip your HLS from it? Okay, next slide. So a very wise man once told me, whatever can go wrong will, and at the worst time. Next slide. So if it is going to happen, were you able to prevent it, or did you at least try? And then did you prepare for it if it was going to happen? And then, of course, these things do happen. So when the rain falls, you just need to manage, and you need to learn how to manage. Next slide. Okay, so I just want to, my acknowledgements are Sherry Lachman. She helped me with this PowerPoint, and all of these people that went before us. Next slide. So we are standing on the shoulders of giants. And these are my references. Next slide. And thank you to our team. This is a photograph of actually one of the teams that stopped a massive disaster from happening. They used the hand crank because our machine stopped because the intervention mode was on. Okay, so thank you very much. I'm handing over to Sue.
Okay, so you touch, you feel, you look, and then you smell. So you have to be aware of the smell in your unit. And those who, I saw some generation here that used to taste back in the day. Fortunately, we don't have to do that. But yes, you have to be fully alert and aware of your sensor, of your surroundings. And then in terms of what you look for, so the checks and balances have already been compiled. People worked hard compiling the list and checks. So when you are at the bedside, you actually have to look at your checklist and check those things. Check that this is working, and if it's not working, do the relevant things, because it doesn't help. Everybody has done all that, and then you didn't check it. Now we're going to go into disaster mode. So check and see that each component, and those people that are tasked with teaching the nurses as to what to look out for, what those checklists means. Make sure that they understand and everybody understand what this means. How do you check it? How do you make sure that it's working? And if it's not working, what are the basic things you can troubleshoot with regards to that? Okay, so that's how our list and checks can actually help us if we are really using it. The 12-hourly check that Kath showed earlier on, the 12-hourly, that's the emergency preparedness. So I would recommend that if you are an RN working with an EN, the RN has to do that, the ones that you do at the beginning of your shift, because it speaks to everything that can go wrong, all these topics that we're going to cover here. And then you are making sure that you are indeed safe and you are ready for if a disaster comes. Then the hourly checks, at your first hour when you start your shift, you would also do that. And then subsequent hours, your EN who's working with you can do that. But initially, you have to do that. So what are we looking for? If I'm just going to pick up on the first topic about bleeding, you're looking for bleeding, you're looking for clotting. How do you do that? Taking bloods from your patient and sending those specimens. Also knowing when to take bloods, depending on what drug you're on. If you're on Preparedness levels, 4 hours after you've administered, you have to take the level. So set an alarm on your phone if you have to, so that on the dot or around that, it can remind you, because we know there's so much going on, you can miss that. And then that affects when the specimen is going to be taken, and it affects all your levels. So set those. At the beginning of your shift, you can plan like that. Okay? And then when you are looking for bleeding on the patient, assessing your insertion sites, actually look and see. Bleeding is not only just obvious, there's hematoma there as well. Check and feel and touch, assess your patient and see that there's no bleeding. Then on your consoles, you're going to have your equipment. Where is my torch? So you have your torches there where you're going to check. When you're checking the entire circuit, don't forget about the membranes. So actually shine a light there, see if there are any clots. On this one, sediments will normally start at the bottom there, or on the other, the marquee one, normally on the sides, at the corners, at the back of this membrane. Shine the light there, not just the cannulas going to the patient. Check to see there. And then along with that, when you're looking at your numbers, when your pressure starts going up, you can then troubleshoot, is there a clot forming? And then we can troubleshoot from there. Okay? And then also important, know who to call. Make friends with your theater staff. Need to make friends. And then, but also at the beginning of every shift, know when a problem happens, who are you going to call? So have this at your ICU chart for the date, who are on call, so that should a problem come, you're not paging through 10 pages. You know it's there at the bedside, and you know who you're going to call for help. Okay? Then you're going to have your trolleys set out for all those eventualities. Should you have a bleed, you need to have a sterile field there. You need to have your clamps. These clamps here, not just your normal artery forceps. These are your non-serrated clamps, so that they don't form a memory on your, when you clamp on your cannulas, but they can clamp, secure your line so that you don't bleed out. And also, if you're going to have any of the accidental things, you're going to need the sterile field with gowns, extra gowns, and all the things that you're going to need for your dressings, which are all here. You're going to need these bulb syringe that they normally keep in theater. Make sure you have some in your ICUs, a couple of them. Because if they're going to be using the circuit and changing things there, they will be needing these, probably lots of these as well. Some of the other emergencies that can happen would be your pneumothoraxes. So if you have that situation, it's going to quickly cascade into an emergency. So you need to be prepared. Have your trolley ready, set out with your bulb syringe, your TUMI syringe, can even have your little suction catheter sometimes. If you need to, they need to suction out a clot from one of the ICU drains that is blocking up and increasing the pressure, and your patient is like deteriorating quite fast. So if you have it there, it's ready. If you need it, you're not running around. Again, depending on that, you've got your gauzes, either it's your abdominal gauzes, depending on which side is going to be bleeding. So all that is there, it's at your disposal. You are in readiness, so that if you don't need it, it's fine. It's fine, it's okay. But should you need it, it's all there. Also, important to have these set of dilators. As I said, make friends with your sister, your scrub sisters. They can give you all these sets so that at least they are there as a backup while you are transporting the patient in that panic. Some of the things they can start using in the unit. As Dr. said earlier on, sometimes they need to open in the unit. So you need to have those things as backups, and they at your disposal. If you're going to be transporting your patients, what we've done, let me show you this. Okay. So you can custom make it to yourself, but have your, for transportation, so for accidental, so you can have your clamps in there, you can have your gauzes in there, so that should a certain disaster happens, you can just pull out this, everything that you're going to need for that according to your checklist is in one. You're not running around everywhere. If it's going to be an airway emergency, you've got your airway box, it will have your ET tubes, your backup things that you're going to need or require for your airway management. Okay, your IV, so if you have your backup inotropes or anything that you're going to be needing for transport, you can just pull that, everything is in there. So you are more organized. So the idea is being prepared is about planning and knowing what you're planning for, and then if it happens, you are organized, that you can pull that quick, and then we can save a patient's life. Okay. Then again, knowing your consoles, knowing your machines, which is part of why we're here. The experts are here, they're going to show us the things to look out for. So that if you know, if there's a problem on your console, where is the emergency button? Where is the emergency go-to place? So get the hands feel in touch. We're going to do that now. How to remove this membrane, how to connect it to a hand crank, and how to work it. Or on this one, how to connect the emergency battery so that you can unhook and your pump can be working while you're waiting. We've activated your help. Okay. And then again, these machines, they are mechanical devices. So my husband always says, I like music. So when I go into the car, the first thing I put on music, and we always fight. He says, you must just drive for like the next 5 minutes listening to sounds. If the car has a mechanical fault, you'll hear a funny noise or a funny sound. So do that as well. Know how your machine hums, if it hums. Know if it's a silent machine, know that it's silent, and check on those things. Because if it's going to start making a crackling sound or a funny sound, or the humming sound that you're used to is now changing, you can then be alert in a way to say, is this okay? Can I troubleshoot? Where is the problem? Then usually if it's a mechanical thing, it will start off with that, with a funny noise. But if you're not listening, have your earphones on, it's not gonna work. Okay.